Now, it looks like the internals here, and I think it was here. Yeah.
What's that right there?
Oops, sorry.
Like the whatever right there. It's still
Wait, now, yeah, this is...
I had to dig deep to get that.
Yeah. So it receives it though, so it should be like kind of attached to the external.
Not sure.
It goes all the way up to the joint.
Yeah.
It's like, yeah.
Okay.
That one in there. Do you see one in there?
It should not be that far.
It goes all the way up to your jaw. Right
That
under it.
one. I'm seeing one in there.
Yeah, this...
Yeah.
Oh,
Yeah, see how this
Right
one
there
goes
where your
all the
tongue
way
yeah,
up.
but I don't know if it goes... It goes... It's going out over here. Alright, we might have to come back to that. Okay. Let's go back to the artery stuff. This one, right off the heart, this is the left... left subclavian. And then this branch is the brachiocephalic artery. And the brachiocephalic artery branches into 3 different things. This first branch is the left common carotid. The middle branch, if you continue, is this, which is the right common carotid. And then the final branch is the subclavian, which I believe got cut here.
It's a little bit right there.
Yeah, that's what I thought earlier, but if you look at it, here it is, and maybe that is, it just didn't look like, I'm not sure it added up unless it got stretched. Yeah, maybe it is.
Some of them still kind of covered.
Might have been. Okay, can't tell that one as well, but it does. Wait.
I think it's cut from that. What's that? That is read.
That's what I thought, yeah, originally.
It's still fatty.
Yeah, I'm not, okay, it's cut a little bit, but it continues down here, and then you see it here, and I can really see it better down here. Okay, so that would be your right subclavian, which armpit area, everything here is now axillary vein and artery, which then becomes brachial vein and artery. And then this is your ulnars, and on the other side your radials. Now off the brachiocephalic trunk, this would have been the subclavian, and then that goes external, or goes jugular vein. Subclavians to axillary. Okay, let's see.
What is this one right here? Because we had one that split too. I thought that.
Cephalic, but you don't have to know it.
Okay.
And it goes up here, in the upper part of the arm.
Okay.
Yeah. Whereas your brachial is going to stay more in the middle.
Okay.
So, anyway, that's what it was. Okay, this is the azygous vein, right here, running, comes off here and down. And then these are intercostals. Yep, intercostals, which will continue and run along the veins. Yep, so intercostals, I can definitely see some arteries. There are veins. Oh, I think I see a vein one here. Maybe I can't. Might be underneath there. Anyway, those are intercostal arteries and veins running directly along the ribs. Okay, now this is the inferior vena cava, which is going to continue down the whole way. Here's a portion of it. And when it goes down here and enters into the liver, those are the hepatic veins. Okay, so as it goes in the liver, hepatic veins. Now this structure is the diaphragm. This whole thing is the liver. And then right here is the gallbladder.
Whoa.
Now this is the greater omentum, the spleen, the stomach. Pancreas is here and continues here. Thin, looks like a piece of chewed up meat, kind of stuck in the mesentery. Okay, that's pancreas. Your small intestines, everything right in here. Now, large intestine. It starts right here with this knob. That's cecum. Yep. So instead of saying large intestine, you got to be more specific. So cecum, ascending colon, transverse colon, and then anything. Yep. Descending colon, and then until you get down here, which is rectum.
Do we not have to, with the transverse and stuff, do we have to know that for this one? Or is it for?
The transverse colon, yeah, it's for this. For this, because it's not only the vessels, because this is the only time we're doing cats, you also have to identify the organs too. All of these
No,
organs.
the organs not in the organs on there, but for the colon, for the larger head, large intestine colon, but it didn't have like the transverse and the descending colon. I didn't see it. Anybody else see it? Because I copied everything down, structure, function, and learn. I didn't see it. That's why I was asking.
Okay. If I'm saying to know it.
Okay.
All right. So it's a possibility.
Large intestine.
Yeah. So I'm saying yes, you need to know it.
Okay. So
That I might
closer to
ask
the
you
rectum
then,
is
even if it's
descending.
not. I don't normally do that, but this is the only time we're gonna see this. So I want you to get it all down now, because for digestive system stuff, we're not gonna look back at the cat anymore.
Okay.
So yeah, I want you to. It is a possibility to be on there. Yes.
So which one was time? Close to the rectum is descending.
No. Descending is anything that's going down here.
Okay.
It's like the aortic arch. The middle part
Yeah.
is the
Yeah, beginning.
Yeah.
Exactly.
Yeah, the beginning
That's
is
a
the
good idea.
ascending.
Okay, so right after the cecum.
Yeah, right after cecum, ascending, which isn't very long
where
here.
is
The whole way across,
Transverse.
transverse, like cross your T's
Okay.
for transverse plane, and then descending, which would be like descending
And
aorta.
that's just for the large intestines, right?
Yeah, just for that, you have to be more specific. And then if it's rectum, it'll be down here further, somewhere like that.
Okay.
Okay, this is the bladder.
Do we have to
little
say
sac?
uterine bladder?
No, just bladder. Just bladder. Now the uterus. I'm sorry. There's no uterus here.
This is a
Yeah, the ureters is what I meant. Is this? So it goes from the kidney to the bladder.
Okay, for a female.
And here's the other one.
No, this
Well,
is
there's
male.
no. This is a male, so that's.
both still
Yeah, both sexes have this. This is just for urine.
so you identify left and right.
Yeah, uterine horn. Or, I keep saying that. Ureters. Ureters.
So for a
Ureters.
female, where would be the ureters?
It's
The same place.
So what
Yeah,
happens-
male and female, it's the ureters, it's the same place.
Okay.
The uterine horn, if it was a female, you would find it
attached to the,
like right here. So you pick up the bladder and then it would come out here.
do it look like two big teeth?
Yeah.
Two different ways. Okay,
Yeah.
that was the
That,
whole-
like a fork.
Testicles on this.
It's castrated. That's one of these unusual cases. So they probably was labeled as a female. They probably thought it was, but it's been castrated. Okay. Now, so got that. So obviously the kidney. So let's go back to tissue layer here. Parietal peritoneum. And now now vessels. So this is in blue, what vein? Inferior vena cava. In red, this is
Is that the
abdominal aorta, or you can just say descending aorta. For me, is fine.
Okay.
Now, what is this? This is the renal. Yep, renal arteries and veins.
Where's the artery?
This one.
Okay.
Okay.
Yeah, coming in. Okay, and we continue down here to look at the differences on the bottom. Now, okay, arteries. This is the external iliac arteries. Remember, there's no common. Yep, it goes right away to external, and then the ones here inside here and here are internal iliac arteries. If you follow the external, okay, now when it leaves the body, now you have femoral arteries and veins running here. Okay, now this guy, his great saphenous is right here, but for whatever reason it didn't get, yeah, the dye didn't go through it. And I can't make it out here because it's cut and it's probably torn. So it's right here, but I think a lot of you have that.
And that's
See it on yours.
right.
Yeah,
made
and then,
that
yeah, if you want to do femoral, the rest is femoral, which will continue down deep, like it is over here, and get deep.
So
That's
from
femoral.
the beginning is femoral until it branches. Then you have the great
Saphenous, yes, and then the femoral will go deeper down.
It turned
Yeah.
into the popliteal, right?
Yeah, eventually, yeah, yeah.
Professor, which one is the posterior and anterior tibia?
We have to cut it.
Oh, no, you don't need it. You don't
Yeah,
have
the
to do it.
model they'll give us. The model.
Yeah, model. Yeah, that's it. Oh, I did think of something else I want to show you. You can see part of the hepatic portal system. Now, how good your view is, I don't know. I had to cut a little bit to find this, but remember, yellow is hepatic portal system. So I cut this out, and you can actually see that yellow.
Okay.
Okay.
You see?
This is the yellow. Okay, so that means, okay, that hepatic portal system comes from the liver, anything in yellow. Now I can follow this to see that this is where it becomes mesenteric, because it goes right here to the small intestine.
So those are the mesenteric.
Yeah, so which now specifically, the yellow ones are mesenteric veins.
So
Yeah.
in the cut, can you tell the superior and inferior ones?
I can't
Yeah.
find the inferior.
Okay.
So this is actually the superior mesenteric.
Okay.
And I mean, maybe if I messed around more, but not.
So like
It was hard to even see this.
So if we're having an exam, you would just take mesenteric.
Well, mesenteric would be here.
Okay.
The mesenteric veins are in yellow. The mesenteric arteries are in red.
Oh, okay.
Now, this is the superior mesenteric vein, which leads to just plain old mesenteric vein.
So are they gonna say identify the structure in yellow? Because sometimes it's not, the colors are not.
Oh,
really
yeah.
showing. Are they
Yes,
gonna
it
say
should tell you, or usually it actually says vein or artery,
Okay.
so you know.
Okay.
Okay, so it'll tell you
But
vein
for
or
the
artery, not
mesenteric.
just blood vessel, because you're right. When you're in an area, it can be hard to say, is she looking at the blue or red? Which usually have the exact same name anyway.
No, but I'm talking about the mesenteric.
Same thing, because this is a vein. I mean, essentially, that's a vein. This is all venous system. So they're not arteries; those are veins.
Okay. Okay. All right. Because I'm confused because in there you see some reddish ones.
Now those are arteries. Those are arteries. It's still the same as arteries and veins, except it's the yellow.
And then the red is the artery.
Yeah, and the only reason that the veins are yellow and not blue is simply because they happen to come off of the hepatic portal system,
Okay.
which in order to help you see it better, they dyed it yellow instead of making it blue.
Okay.
Okay, so you could tell what was from that and what was the regular veins.
Okay.
But they're all veins. Okay, so definitely superior mesenteric and then actual just mesenteric arteries and veins. Veins are yellow. I can see that. I could see the one going to the spleen. I found it somewhere here. I dug through some tissue and I don't know where I can find it at. I found it somewhere here.
After a while, they all start looking the same.
Yeah. Well, I had to dig to find it, but I found the yellow, and I don't know where I came up with it at.
Right there.
Okay, yeah, but that's going this way. I found some. Oh, there's where I found it. Here we go. I had to dig through some of this omentum, but you see now? See the yellow? Okay. Now, yellow also means veins, right? But it means that it came from the what? Hepatic portal system from the liver. So this is the splenic vein, which I'd continue to cut. It's going to end up coming to the spleen. So that's the splenic vein.
Okay.
Okay, so I can make out those two. I haven't been able to come up with the inferior mesenteric vein.